Okay guys, welcome to the third part of the introduction to clinical anatomy and embryology. I'm Dr. Cobb, and today we're going to start to talk about the embryology of the musculoskeletal system, and we're going to start to look at some parts of the cardiovascular system, just the introduction to. So we're going to start by looking at the embryological development of bone and how bone forms, and then we're going to start to look at the anatomy of bone. So most bones first start to appear as condensations of something called mesenchymal cells. So I'm just going to highlight these for you. And they give rise to something called hyaline cartilage models that ultimately ossify via something called endochondral ossification. So by the end of the lesson, we should have a little bit of an understanding about this process of endochondral ossification. And so here we can see a little schematic of how the bone starts to form and starts to spread, and ultimately the communication between these cells is what allows this to happen, and that's what we're going to look at today. So other bones develop in mesenchyme by intermembranous bone formation, and that's what we're going to consider over this lecture and over the next few weeks. So an overview of the skeletal system. The human skeleton is divided into two descriptive regions. We have something called the axial skeleton and the appendicular skeleton. So these are the two parts of the skeletal system that we need to be aware of. The axial skeleton consists of the bones of the skull, the vertebral column, the spine, the ribs and the sternum, which form the axis or central line of the body. There's 80 bones in total. The appendicular skeleton are the bones of the limbs, including the pectoral and pelvic girdle, which attach the limbs to the body's axis, and we have 126 bones in this region. And so in this picture here, we can see the axial skeleton and the appendicular skeleton. The axial skeleton is in a slightly more reddish colour, and in the more kind of bony colour, we can see the appendicular skeleton. And as the name suggests, appendicular means appendages. So you can see that the appendicular skeleton just connects on to the axial skeleton. And this becomes really important when we start to talk about the nervous system, and we talk about the plexus of nerves, and we talk about the central nervous system, the brain and the spinal cord, which really communicates with the axial skeleton, and then the plexus, the brachial plexus and the lumbosacral plexus, which really communicates with the appendicular skeleton. So here we can see different types of bones. We have long bones, short bones, irregular bones, flat bones and sesamoid bones. And as we progress through our course over the next few weeks, we shall start to learn about all of these different bones, about the histology of bone, and also about the function of these different types. We also have different types of bone structure. We have something called compact bone and spongy bone. Compact bone is a relatively solid mass of bone, and it provides strength and support. Spongy bone, trabecular or cancellous, is a less dense trabeculated network of bone, spicules making up the substance of most of the bones and surrounding an inner marrow cavity. And so if we take some cross sections through bone, we can see the different parts. So we can see the outer region, the compact bone, and the inner softer area, the spongy bone. And you can really see the difference, and certainly when we start to go through our histology, you'll start to look at the different structures within these parts. Much stronger supportive network, compact bone, and the inner more permeable layer, the spongy bone. And as you go through the different parts of the bone, you can see the difference in how that's spread. If you take a cross section through a piece of bone, you can see different areas. You can see the articular cartilage, the soft bone and the hard bone regions, and of course throughout the bone you also have important nutrition added to the bone via the vessels and the lymphatics, which we'll start to look at. So functions of the skeletal system: support, protection of vital organs, a mechanism along with muscles, form of movement by the musculoskeletal system, storage of calcium and other salts, and a source of blood cells. So we need to understand that when we talk about bone, we need to add some clinical component to this. So the most common thing that we discuss is bone fractures. We have 4 phases of indirect fracture healing, and these are the following. We have fracture and an inflammatory phase, granulation, tissue soft callus formation, hard callus formation including woven bone creation, remodeling including lamellar bone creation. And this is what we go through as we start to look at this histologically as well. So here we have the first stage, the hematoma formation. This is when we first see the patient who has fractured the bone. We see the bone is fractured, we see the hematoma starting to form. The second stage is the fibrocartilaginous callus formation. This is where we have the new blood vessels starting to reattach and the spongy bone trabeculae starting to make a network mesh between the 2 fracture points. The bony callus formation is the third stage. It's a bit like the super glue, bringing everything together and creating this new remodeling phase, which is the final stage where we see that the bone has been fused together. So we have something called the bone remodeling cycle, and you can see that this goes from weeks to months. We have a catabolic stage in the weeks and an anabolic phase in the months. So what happens is we have the pre-osteoclasts coming through to the active osteoclasts, to the mononuclear cells, to the pre-osteoblasts, to the osteoblasts, to the osteocytes. And these cells are important in the different stages. So we have resting bone, resorption, reversal, bone formation, and mineralization. And so we will go through these stages, and we'll go through this as we progress through. Joints are the site of union or articulation of two or more bones or cartilages. We have different types of functional structural classifications for articulations. We have a functional categories. We have a structural category and type. So we have fibrous sutures, gomorphous, cartilaginous, bony fusion. So fibrous suture, it's a suture or a sewing together. Gomorphous is a bolting together. Cartilaginous is a rigid cartilaginous bridge between two articulating bones. And a fusion is a totally rigid, immovable joint. And so we will go through all of these as we start to look at the different types. And so here we can see some examples. We can see a suture, such as found within the coronal suture, and a syndesmosis, as found in the radius and the ulna. The fontanelle closure. In humans, the sequence of fontanelle closure is as follows. We have the posterior fontanelle, which closes generally 1 to 3 months after birth. The sethmoidal fontanelle is the next to close at around 6 months after birth. The mastoid fontanelle closes next from 6 to 18 months after birth, and the anterior fontanelle is generally the last to close between 7 to 12 months. And here we have some of our other categorizations for articulations. We have the fibrous, syndesmosis, cartilaginous, symphysis, and a synovial. So here we can see a synovial joint. We can see how the bone is dressed by the periosteum. We have a ligament around the joint, around the fibrous capsule, and the joint cavity, which is going to contain the synovial fluid. So if we look at the knee joint in a little bit more detail, we can see a cross section through of the femur. We can see the hard bone, the soft bone, the part of the tib, transection through the tib. We can see the patella. We can see the joint cavity around the back of the knee joint, which is very, very important that we have our synovial fluid to allow function at this joint to occur. So we'll really start to look at the mechanics as we go into our MSK module. Osteoarthritis is a degenerative disorder, and it's arising from the biomechanical breakdown of articular hyaline cartilage in the synovial joints. The current view holds that osteoarthritis involves not only the articular cartilage but also the entire joint organ, including the subchondral bone and synovium. So this is something certainly you members who are going to be working in MSK or sports rehabilitation are going to become very, very proficient at looking at this and seeing the differences on imaging, which we start to look at a little bit later on in the course. So here we can just see an example, an X-ray example. You can see the spacing of the joint. So if we just look at a normal knee, we have the femur, the tibia and the fibula. We have this fairly regular gapping between the two. Then as we look at a pathology, we can see the osteocyte formation and the joint spacing starting to narrow. And you can just imagine, if you think about the flexion of the knee, if you flex your knee, you need to have some space in order for that to be able to work. If you think of a door, when a door swells because of the weather, the door doesn't close, or it doesn't close well. It's very, very similar. Again, this occurs in all of the joints. So this is an example of a healthy hip joint. The head of the femur within the acetabulum. The head of the femur fits much like a ball and glove. The osteoarthritis causes changing in the movement, very similar to as we've just discussed. And these are some examples of surgical procedures: total knee replacement and a total hip replacement.